Hello, very good afternoon to everyone for this live LinkedIn session on healthcare security and smart authentication. I'm Niharika from DSAI, and we are here with our very esteemed experts from the IoT and healthcare sector and in identity access management IAM experts with us who will be taking up this discussion. So, the main objective of this webinar is to emphasize the significance of IAM, that is Identity and Access Management in the Internet of Healthcare Things, that is IOHT. And we are here to explore the advancements and challenges in the healthcare cybersecurity, focusing on secure authentication, compliance, and emerging threats. Additionally, the discussion will also cover the role of generative AI, IoT security, the research, and the workforce development in shaping the future of healthcare security. Our key discussion topics will be industry challenges, technology and innovation, consumer IAM implementation, future trends, academic research and innovation, and workforce development. So, let me take a chance to introduce our speakers and the panelists. So, the session will be moderated by Mr. Arvind Sivaramakrishnan. He is the CIO, Carnicos Healthcare. The academia part will be discussed and will be thrown light by Professor Shabana Mahfouz from the Electrical Engineering Department of Jamia Millia Islamia. We have Professor Mevash Vikar. She's also from Electrical Engineering Department of Jamia Millia Islamia, to throw some light and give us insight about the industrial development of IOHTIAM. We have uh, with us Mr. Sandeep Padam. He is the CEO and co-founder of Astronova Labs. And we have Ms. Jenny Susanna. She is the head enterprise business and strategy Zoho. So I'll ask Mr. Arvind to take up the session, sir. We can begin
Thank
it
you.
now.
Thank you, Niharika, and good afternoon to everybody. Thank you, my friends, for joining us this afternoon. So, I'll probably start off with the academia, and obviously, the focus here is tilted towards healthcare and tilted towards healthcare for multiple reasons. And the context here is that healthcare has obviously been slower on the entire digital transformation agenda. Despite it being slow on the digital transformation agenda, over the past few years, the acceleration has been significant. So it's almost now fair to say that slower is a thing of the past, and now the need for it is faster. Healthcare being a subject of interest, a subject of importance that concerns the individual self. Obviously, the degree of importance, the seriousness of all of that takes a manifold increase in stature. So, on the academia side, I've got Singh, Dr. Mewash, and Singh, Dr. Professor Shabana. I want to start off by asking both of you in terms of in the field of cybersecurity as it relates to identity and access management and as it relates to overall privacy enhancement and such like security solutions as well as enablers for actually delivering cybersecurity and privacy the way we all want to consume it. Uh, from the academia side, what sort of research and innovation are you seeing? And particularly, if you can lay stress on how you see all of this in terms of the very Indian context. If I can start with you, Professor Shabana, and then Dr. Mewash, if you can take on from there.
Thank you, Mr. Arvind. On this, specifically, I would like to Ms. Mehvish to throw some light first of all regarding the mapping. Ms. Mehvish, yeah.
Yes, ma'am. Now, first we'll discuss why security is important. Why? What is the need of this healthcare security? This we are seeing that with the rapid adoption of Internet of Healthcare Things devices, ensuring strong cybersecurity measures is essential nowadays. Now, why? Why to safeguard and preserve patient personal health information. Second is sustaining operational availability, that is, no disruption of medical facilities to the patients. Second is avoiding monetary risks because we are seeing many ransomware attacks nowadays on hospitals and That's why avoiding these risks is very important. Then developing patient confidence in the healthcare facilities is nowadays very important due to data theft. Next is preventing unauthorized access of to this healthcare systems and combating advanced threats. Advanced threat means advanced persistent threats, the continuous threats that are there in the medical healthcare fields, and zero-day exploits. There are many vulnerabilities present in conventional password-based authentications. That's why the current landscape of academic research and innovation in healthcare security has seen a significant advancement in research in response to these rising cyber threats, and particularly the ransomware attacks, data breaches, and vulnerabilities that are connected to medical devices. In this trend, we have seen the medical advancement in the field of identity access management. What do you mean by identity access management? Is authentication and authorization. Authentication and authorization means only the person that has the particular access rights can are authorized to use the medical system, medical healthcare facilities. Now, in this identity access management, nowadays the innovations cover the multi-factor authentication mechanism. In multi-factor authentication mechanism, we have seen that requires users to provide many factors, two or more factors, verification factors to access a system, which reduces the risk of unauthorized access nowadays. Second are the threat-based access. The dynamic mechanism of authentication automatically modify the security requirements by evaluating the risk in response to the action of users, the positioning, and the equipment category. Next are the certificate based authentication, where there the academics provide the certificates to the authenticate the users. Then the privilege access managements. Now privilege access management are being based on the privileges. They decide the type of access given to a particular doctor type or technicians or the nurses or whatever. So they decide the access type of access, and they give the privilege to access the rights. Now with the advancement in these things, now second research category deal with the AI and ML based smart authentication and authorization. In AI and ML based smart authentication, the first and foremost are the biometric innovations, where we use the iris scans, the fingerprints to authenticate the users. Second are the continuous authentication mechanism. In continuous authentication mechanism, they try to dynamically, continuously, they monitor the access and authorize that based on that particular access, they authorize the users of the medical facilities. The continuous monitoring is being performed based on the AI models. And then is the intelligent access provisioning, where the AI tools suggest the appropriate access rights based on their field, based on their position. Then adaptive access management is the recent innovation in this category. Adaptive access management based on the scenario, based on the type of threat, based on the type of medical facility they are seeing, they change the access rights, they adapt access rights based on that particular field. Then now in the more recent field, we have generative AI. The upcoming field is the generative AI. The generative AI, basically generative AI, they what do they do? They, by generating synthetic data, they train the models and enhance biometric systems. Generative AI has excellent prospects for enhancing smart authentication. It is an innovative approach for improving the intelligence, security, and usability of authentication, particularly in complex scenarios. There are many categories in generative AI. First is behavioral biometric authentication. Here the generative AI role is to generate the synthetic data based on the behavior of the users. They assess the behavior, then generate the data, and based on that the models are trained. This gives a huge data set to train the model and enhance the accuracy of the systems to authenticate the user and to grab the malwares. Then second are in generative AI, next is the biometric verification. They perform the biometric verification based on the generated synthetic data. And authentication based on synthetic data is why it is important to use that synthetic data, because synthetic data is used in place of actual user data, which may be hard to come by because of privacy concerns. To enhance the authentication system, this generative AI, in order to help AI models train more efficiently and without gaining access to the confidential personal information, they use only synthetic data to train their models. They don't use that particular data. Then AI generated multi-factor authentication is another innovation in this particular field. They generate those multiple factors using the generative AI models. So these are the few basic innovations that are being performed day by day in the medical cybersecurity field, in healthcare fields. Now, mapping this academic research and innovation in healthcare security to real world industry is another a challenge. This requires bridging the gap between theoretical advancements and practical applications. Now, there are certain steps we can do to bridge that gap. Is first of all, we have to identify the key industry challenges. To ensure relevance, the primary security challenges in healthcare need to be defined. For example, the ransomware and malware attacks on healthcare systems or securing the IoT devices or medical equipment, we have to identify what field we are concerning. Then we have to ensure which regulatory compliances they are adhering or not. Then protecting patient privacy in the cloud telehealth solutions is another field. Then combating the phishing and social engineering to healthcare staff. Then, second, we have to characterize the research and innovations. Academic research often explores many specific areas like AI and ML related searches, blockchain technologies, zero trust architectures, privacy preserving techniques, behavioral models. These are the basic researches. Now we have to build the translation layers to connect this theory with the industry. First of all, for this, we can take these three steps. First is validate and test. We have to perform the validation and testing to collaborate with the industry to validate the academic models in real world healthcare environments. Then prototyping and piloting those tests. We have to build the pilots for testing innovative solutions such as deploying AI powered threat detection modules in healthcare or hospital networks. Then standard alignment. We have to incorporate the regulatory frameworks like HIPAA, HIPAA, and GDPR into academic projects. We have to give the knowledge of these regulations to the academic projects, and we have to incorporate how these models need to be developed based on the regulatory compliances. Then fostering the collaboration. Fourth step is to collaborate. How to collaborate is here. Three steps we can choose: industry academia partnerships, where establish innovatives where academia can work directly with healthcare providers and vendors to address pressing issues present. Second, and hackathons, host events to explore brainstorm practical applications, academic innovations. And second is open research data, where provide the researchers for developing validation solutions. We have to give the framework and the platform. And the last step we can say is scale the real world impact. Here in this, we can say the commercialization, encouraging of startups based on promising academic researches. Second is training and awareness. We have to use these research insights to develop the training for healthcare staff on best practices and emerging threats. And third is integrating with existing systems that design the solutions to integrate seamlessly with legacy infrastructures and adopting with feasibility. For example, we have a problem of ransomware targeting any electronic healthcare data. We have to perform a research based on AI, ML, detection of the network traffic. And then the solution is to deploy that particular EHR algorithm of EHR systems, detecting and then isolating the threats in real time and meeting with the regulatory compliances. So, this process enables innovations to move beyond labs and address the real world healthcare security challenges effectively. So, we can say that to understand the cybersecurity is not only it is not a simple only technical necessity, but rather a strategic necessity. for ongoing operations and future sustainability of a business. Since threats are evolving and now more frequent and complex threats to organizations are seen, so organizations need to have protection that can cover endpoint networks and clouds. So for this, we have to train our
Hmm.
staff. Now, ma'am, you can
Actually,
just yeah.
Dr. Mivash, thank you for that. Professor Shabana,
Yeah,
based
thank
on
you.
these approaches to research innovation and how they are being structured, one question for you is, how do you see this collaboration between industry and academia? That's one part of my question. And I'll lead it also in terms of, ultimately, it's the academia that's actually into the workforce development. And a lot of the workforce development is not only going to be those who are fresh out of college getting into the industry, but also those in the industry who need to be further upskilled. And they'll be occupying several levels of senior positions, but still not, valid thing with them. So, how do we upskill them? And obviously, also, if you can help me map this also to, while we are doing this innovation and research, how are we looking at adapting these to the now mentioned Indian standards of the DPDP bill, or even the IT Act in its totality? While we may have our views in terms of the shortcomings of it, but still the IT Act is governing all of us, and the DPDP is the new act that has come up. The working rules have been sent out. If you can give us your views on how you see all of this coming together for the workforce.
Yeah, thank you, Mr. Avan. Thank you. So basically, whatever I will be talking about, I'll keep this DPDP Act, which is there, Digital Personal Data Protection Act, along with what I'm going to. So I start with the basically the first thing that I would like to tell about is like what is the training and knowledge which will be required first of all for the healthcare workforce professional, because they need to comply with the DPDP law and also ensure the healthcare data security and privacy. So the very first thing would be keeping the DPDP in mind, understanding the legal obligations. That should be one thing which has to be there, where there are like two parts to it. One is what are the data protection principles which are as a part of the DPDP has been given, which are the principles such as the lawful processing, purpose limitation, data minimization, and user consent. So one is understanding these legal obligation, and then also understanding the roles as well as the responsibilities which have been laid down. For example, let's say I will not define the roles here, but I'll just give the name. Let's say the data fiduciary, data principal, data processor. What are they as per the law? So that that understanding the legal obligation, that understanding has to be developed. That is one of the important thing out here. Next is to have the best practices of privacy and security. First of all, identifying what are the best practices and then having those practices there. Like, for example, the data handling protocols. So, what are the methods to collect, store, process, and share the sensitive personal data securely? That understanding has to be developed. Breach reporting. Okay, the healthcare workforce should be trained for that. Like, what are the steps for timely identification, reporting, and then managing these data breaches. Okay, the incidents response. Third party data sharing, which is very important. So the awareness should be there of the contractual and the the legal obligations when they're dating the sharing the data with the vendors or let's say the partners. So this third party data sharing is very important. Then comes the technological skills actually. For example, encryption and anonymization. Okay, so these are the techniques to secure the sensitive health data. So they're supposed to be trained on both the techniques. It should be there. It's very important. Then, with respect to security, healthcare data security, or in fact any industry, access control is very important. So, implementation of the least privilege principle using the RBAC, that is the role-based control, that's very important actually. because any individual, according to access control, should only have the minimum level of access which is necessary for performing their task. For example, let's say if it is let's say a healthcare scenario, so if it's a doctor, so let's say for example they can access and update the patient medical records. If it's a nurse, she or he should be able to view the patient medical records but not update them. Receptionist can only be able to, should be only able to view the appointment schedules and not the update the medical records. So all these kinds of role based access control mechanism needs to be understood by the workers. Then some knowledge of secure communication channels, okay, has to be there, like training on the secure transfer protocols, for example, like https or sftp, that should be there. So, and the risk management, okay, so they are supposed to be trained at risk management, the which means that data audits should be happening. So conducting of, regular third party audits to ensure the compliance, okay, should be there. Risk assessment has to be done, has to be carried out as a regular procedure. So identifying vulnerabilities in the healthcare system and mitigating them, and then how to deal with the incidents, that has to be there. So then what should be the aspects that the healthcare workforce must be equipped with at different levels? So first comes the awareness, actually. So awareness has to be created. So the legal framework, understanding the DPDP law, HIPAA, if it is applicable, and global standards like GDPR. So that understanding of this framework needs to be there. Then the patient rights, so awareness of rights like data action, correction, portability, deletion. So this has to be, this awareness should be there. Then comes, okay, so once this is there, then training for the compliance frameworks, how to implement the data protection policy in the healthcare settings. So that training needs to be there, and incident management training also, how to deal with the data breaches, including the response and then the recovery also afterwards. So this kind of training has to be conducted. And the expertise in the data governance, that is policies on the data classification, retention, how to dispose the data, what should be the period for that, so all that needs to be there. And the familiarity with the tools for identity management, network monitoring, endpoint security, that also should be a part of the training. And basically it's basically a cultural change which needs to be brought in now. So we it in any healthcare organization, so creating an organizational culture that should prioritize the data privacy and patient's trust, as Miss Mavish already pointed out, and ethics training basically. So emphasizing on the ethical handling of the patient data in context of AI as well as analytics. So that should be the thing going on. And now how academia can help in building up, upskilling or building up this workforce. So what can be done by academia is, I would suggest that first of all, looking at all these, what are the scope, what is the scope, what is the requirement, developing the curriculum and the certification programs for this. Let's say we can have privacy and security modules where introducing specific, courses on privacy laws like DPDP and healthcare data protection standards, so that it creates an awareness that the knowledge of this can be provided. Certifications for professionals at higher level can be done for upskilling them, and in this collaboration with the industry and government, okay, to offer the data privacy compliance and healthcare security. So their industry can help to academia, okay. Conducting, as Mavish also pointed out, conducting workshops and trainings. So awareness programs should be conducted, like we are hosting this webinar, similar webinars, conferences, and training sessions for the healthcare professionals. For each, level, different type of training can be provided as per their role. Scenario based training, as Mavish also recommended this, simulating the real world challenges in the healthcare data handling and the breach management. That is going to be really very beneficial if something like this is taken up. So, and obviously R&D, she has spoken a lot about R&D. So tools and framework development of AI ML tools for automated compliance checking also can be done. Automated compliance checking, breach detection, risk assessment, all that can be done. So tools and framework can be developed by other R&D of academia. And then even policy recommendation, like conducting studies on the effectiveness of DPDP implementation in the healthcare and suggesting further improvement if possible. So that also can be a part of then R&D. So how like industry, how can industry help get together with academia and help for all this, like collaboration now in this. Now here comes this thing, that collaboration with industry, because guiding the healthcare firms on how to align their system and process with the legal standards going ahead, that can really help. Knowledge sharing will be there. So building, like it could be an open access kind of database or repository, let's say for best practices, for checklist, for case studies. So that can happen, in consultation with the industry. So if we can say that encouraging the healthcare leaders basically to prioritize the training and the compliance. Okay, while maybe said that academia can step in as an enabler, and that is going to lead to building a culture of, let's say, trust and security in the healthcare, through with along with the laws, with the well trained professional, and a partnership between the academia and the industry. So whatever academia wants to go ahead with, that they can consult that, that part, and get the problems from the industry, and whatever research they are doing, that should be industry oriented actually. The problems which are being faced by industry, that should be taken up as a research problem. That is what I would like to suggest actually.
Thank you, Professor Shabana. But one question before I move to my colleagues in the industry. Uh, how do you see the upskilling happening? A lot of things, this gets into, if I may say so, the younger age, fresh out of college or fresh out of academics profile. But there is an inertia of this getting, when we start talking of the experienced people in the industry who are already working and sitting in positions of decision making. How can the academia, and also it's not just the research and innovation that Dr. Mevash was mentioning, but also in terms of how do you get that ingrained into the senior level thinking, because the senior level thinking is what guides the policy of organizations to function. How do you think academia can help in changing that culture and bringing that culture into a little more breadth of innovation?
Okay. You see, for that purpose, we need to, like I said, they must be the leaders of the healthcare industry, the top level management and other. So academia should reach out to such industries and offer what they have to offer actually. And by they will only convinced if you try and show the what is the advantage of doing this. So when they chalk out their own plan, they can offer this to the industry people. So whatever is their requirement, first we need to understand, academia needs to understand what is their role and responsibility, and what have, because see, for every level of the executive which is there in the healthcare industry, there will be a different type of things which academia can offer. So to the top level management, because they are the driving force behind everything, we need to make a plan and I think offer to them with along with the advantages and what how it's going to help the industry itself actually. So that kind of when we offer them that kind of help, and when we make them realize actually said how this is going to that their upskilling, how would it going to help their industry itself. So that's how one can approach actually the academia, but academia will have to chalk out first of all their own plan, what they want to offer actually.
Thank you for that, Professor Shabana. I know you got a tight schedule also, but thank you so much for this. But and now I'm going to probably indulge with my industry colleagues also. But before that, I see two questions that I thought I'll take the liberty of answering in the Indian scenario with HIPAA. Whether HIPAA is applicable, we have DISHA, DPDP, and then there's another question on any professional cybersecurity certification specific to healthcare. See, obviously HIPAA is not applicable to India because it's not a law that governs India. So very clearly HIPAA has no applicability there. But that's really not how you want to see it. HIPAA is something that governs the United States. But if all of us can take it as a guideline document that is there. Similarly, GDPR is applicable to the European community. But if these can be taken as a guideline document, because ultimately we are talking about doing the right thing in terms of policies, procedures, innovations, and actually bringing it into our day-to-day practice as we deliver healthcare. So if we take these as guidelines and look at the applicability of the guidelines and how we can enhance and adhere to best practices, how we can innovate so that best practices are ingrained into the DNA of our processes. That's really how I would read HIPAA or GDPR, not verbatim as an applicable penalizing law. That's saying despite its applicability to our geography. Professional certifications on thing, definitely Data Security Council of India is doing a lot of certifications on cyber security, privacy. I'm taking the liberty to speak on behalf of Data Security Council of India. There's a privacy lead auditor, there is a privacy officer certification, and all of this. I must tell you that it's not about is it for healthcare. It is about the general industry, because here we are talking about everything, and then as industry members we start looking at applicability. These are not like certifications for healthcare or automotive or financial, but these are certificates that bring up the entire quality, because there is no known pattern of privacy and security attacks and risks, and that's why these certificates are there. So I would encourage you to please look at the DSCI website. Niharika can send out details later on also, but do look at their red teaming, ransomware thing. Response trainings. They do that in person, they do that online, and the privacy training, the privacy officer training, and the lead auditor certification. So please do take a look at the DSCI website. You will find something that is very relevant and applicable to this. Yes, Sandeep. Yeah.
Arunji, thanks. I would just like to add regarding the point of applicability of HIPAA, right? So, as you rightly mentioned, that it is not a mandatory, a compliance to be adhered to in the Indian context, but then it is something which conveys what are the best practices that we need to follow. Right now, similarly, I'll give another context regarding ISO 27001 and the NIST framework. Right now, NIST is not applicable again in India, but and at some time back, even ISO 27001 was something that companies adhered to showcase, as part of their assurance mechanisms to the potential clients that okay, we are aligned to ISO 27001, which is the global, which adheres to the global best practices. And of course, you can map controls of 27001 to NIST as well. Now, with the latest SEBI, cyber resilience framework guidelines coming into play, if you have not read it, it's a 205-page behemoth of a document, but it goes into details of how an organization can take care of their cyber security posture. So that way, even if it is not mandatory to comply, it is always good to look at them from the point of view of how you can strengthen your information security posture. So that is very important. Yeah, thank you. That is
Perfect.
what just I wanted to get
Perfect,
that
Sandeep.
context.
Thank you. And now that I have you, I'm going to probably start with you on the industry side. See, IAM obviously, we've been talking of MFA being the gold standard, but today that gold standard itself is getting questioned, and you're looking at attacks with the IAM itself. And we're also looking at while we talk of IAM solutions and technologies, we are also faced with a reality that access and identity in organizations are not centrally managed. So, with this kind of a difficult constraint versus promise of technologies, take us through in terms of where you see IAM going in, and what is the reality of IAM being put in there. If I can use the modern day IAM, if I can call it, for the lack of better articulation. How do you see that going in?
Yeah. Yep. Thanks for that question, Arvindji. So, see, again, now when we look at identity and access management landscape as a whole, right? So there are a lot of technologies, a lot of components which cover up what constitutes within this IAM ecosystem. But I will give you an analogy with respect to the theoretical concept and the practical one. So when we talk about network layers, right? The OSI describes 7 network layers, but in practical, when it was actually implemented, we came down to 4, right? We call it TCP/IP stack. Similarly, there are a lot of components which constitute what IAM would be comprising, but the way industry is going, we can broadly break it down into 3 essential pillars. And let me take you through these pillars. Number one is authentication or single sign-on, right? So what is the first point of entry into a digital ecosystem, whether it is healthcare or any other industry? That is that you need to provide your credentials and to gain access into that particular system. Second is, once you get that access, then how do you make sure you have the right level of access to the application that you need? Once you provide the right credentials, it should not give you the complete keys to the kingdom. So there has to be some access control mechanism, like it was also deliberated upon in the by previous speakers. So you need to have a technology in place which makes sure that it maps you to the right application. And another dimension within that application is something known as the right entitlement is nothing but the kind of role that you have, whether it is at a super admin level, admin layer, admin level, or a normal user level, or even no access is a control that needs to be considered. Now, and this is called identity governance or IGA. So we have authentication, we have identity governance, and third suite of technologies which is there prevalent is something known as privilege access management. Again, that is also something which was touched upon a while back. Now, IGA, authentication and IGA work at application layer. And when we talk about PAM, it is also giving access to identities, but a layer below application layer, right? To the servers, to the hardware, to the firewall, to the operating systems. It manages at that layer. So overall, we have these 3 pillars: PAM, IGA, and authentication, which are widely, vendor-wise, you can distribute in the industry. So uh, going ahead now, what is the status on ground that we, as part of our experience when we are interacting with various clients, we have witnessed, especially with regard to healthcare, is that there are a number of silos which are present in terms of identity governance. So ideally, what should happen is that once a person is onboarded into an organization, say a healthcare system, as soon as his ID is created in a HRMS system, it should automatically be provisioned into all the other applications which are prevalent within the organization. But on ground, the thing is that ID is created in HRMS, then probably an email or some sort of a notification goes to IT team. They will create an entry in Active Directory. Almost all the all the healthcare systems that I have interacted with, they are this is the way that they are presently operating. And then for giving access to any other individual applications, again, if it is syncing with Active Directory, the access is there. Otherwise, a manual intervention is required. Now, this is the easier part. The difficult part is when that person leaves, right? How are you sure that he is completely out from your enterprise ecosystem? He may be joining some other organization, but still have access to your application, your ecosystem. That is something which is not managed as of now, because of the fact that all these touch points, the identity creation touch points, are completely distributed. And this is problem is potentially more, I find, in the healthcare sector. In fact, if we look at the data breach investigation report of Verizon of 2024, it clearly mentions that healthcare sector is the fourth most sought after vector by all the adversaries, because of this very fact. And of course, to compound the problem, there are IT systems and there are a lot of IoT systems also. All the other equipment which needs to be operated, say your radio equipment, your other biometric equipment, all the other patient assessment systems which are there, all of them are again not controlled centrally. All of them are distributed, and again, this is not a problem related to healthcare. This is would be applicable in any other manufacturing sector as well, right? And so this is one sector when we are talking only about the regular employees of the healthcare sector. Now this sector also thrives a lot on contractors, right, on consultants, so and on people who come on a short term basis, right, interns. Now what kind of access they have to a patient data, as you know, Professor Shabana was saying, role based access management, right? How do you make sure that a view that is applicable for a nurse is not applicable, is not visible to an intern, and similarly something which is visible to a personal doctor is not visible to anybody else. So in the absence of such controls in place, such a distributed environment, it is very difficult to assure the customers or to the board members or to yourself that this is something that we are complying to, especially with DPDP guidelines coming, which clearly mention, in fact all guidelines, if we say, they have some commonalities, taking from DPDP, whether you talk about GDPR, whether you talk about LGPD of Brazil, or any other country, all of them talk about specific point of accountability. There has to be a data processor, there has to be a data fiduciary, there has to be a data controller, right? That person is accountable for the care of sensitive data, right, or processing of sensitive data. Similarly, all of them do talk about role based access management, and all of them do talk about the fact that a role which is assigned to a person is not a one time activity. You have to do it on a periodic basis. So so that is something that again is mandatory as part of DPDP, and in fact it is broadly covered across all the guidelines. Now in an absence of an automated system, in an absence of a system where we don't have that central visibility, it is very difficult to manage, right? You would have your ad hoc processes, you would have your manual processes, which would be doing this, and when we get into a manual mode, they are bound to be error prone. Audit in some cases, in these cases, is always a nightmare, right? Most of the times, the most difficulty that we have in interacting with the healthcare professionals or the IT team is that all of them are busy in audit all the time. So so because again they have to extract all this information manually. So that is where the things are. And I just take 2 more minutes to share, like the use of generative AI that we touched upon. All of us are aware the disruption that DeepSeek had caused last 48 hours. So how does that impact the healthcare sector? Of course, the race between adversaries and the good actors is like a cat and mouse game that goes on. And just like we tend to capitalize on the gains made by the AI space, of course the same is being chased by the malicious actors as well. But the point is, in a system which is controlled, which is centralized, this if you have an AI component baked into it, the benefits that you garner out of it can be many folds, right? So it not in terms of operational efficiency, but also in terms of inherently making sure the systems are behaving the way they are supposed to be behaving. You get that predictability factor coming into it, because whenever there is a deviation, there is something, a non-human bot, which is working within the confines that you have defined for it, giving you that very input at that very time. So again, it is a very overall, if based upon our experience, if I look at the healthcare sector, there are many gaps, there are many opportunities, and definitely if we are able to capitalize on the technologies which are available as of now, the change will be very much visible and tangible. So, and just one last thing I'd like to say is that when we talk about vulnerabilities, right, vulnerability is binary in nature. Whether it is, if it is there now, you plug it, it is gone, then you look at something new which is coming. but the risk to an identity is cannot be mitigated even in theory, right? If I have a ID now, I have access to multiple systems. After 5 seconds, also, the state might change, so I have to keep an eye on it. So yep, that's what I'd like to share. Thank you so much.
Thank you, Sandeep. Jenny, you heard the academics speak. You heard Sandeep, and if I can, brave myself into a commercial for Zoho, and I'm sure you Sting told Sandeep, there's no problem in IT people facing any audit. You should have been using Manage Engine. I can brave that commercial for you. But when you look at a company like Zoho with the innovation that you've done, with the practicality of how you're looking at how these are applicable to a typical IT manager in a healthcare setting, or how you look at adapting solutions and technologies for managing privacy, for managing IT governance controls. How do you see the roadmap of technology supporting the whole security industry? How do you see the applicability, and how do you see products and services shaping up?
Okay, thank you, Arvind. I think my fellow panelists have given a wide view into what IAM is and how it applies to healthcare, especially. So what I want to touch upon, I want to actually take off from where Sandeep left, basically. So he was talking about the pillars, right? So I also want to touch upon those pillars. When we primarily talk about implementation, I just want to summarize the entire conversation into how we implement it at the end of the day and how it will help comply with the regulatory bodies that we have to comply with as well. So the first thing, like we said, is authentication. So if you see that there was first an era of passwords, right? All of us were using passwords. We know that passwords are extremely complex. One of the things that are very weak and easy to steal as well. So oftentimes, right, as technology evolves, one thing that I've seen as someone part of the tech industry, right, we're very quick, especially as product-based companies. We want to stay ahead of the curve. We want to develop the next big thing. But we realize that at the end of the day, when on field, when we're talking to clients, or when we analyze statistics of previous breaches that have happened, oftentimes it's this basic controls that haven't been met, right? Attackers, some of the biggest attacks have been due to just simple credential compromise or a stale account lying in the environment. Like Sandeep was saying, that's a huge problem in a lot of enterprises, making sure that when a person leaves, proper deprovisioning happens, right? The accounts are cleared, the mailbox is put on litigation hold, and all of their controls are revoked. So all of this has to be very systematically done. And I think a testament to that has been the COVID era, right? Right after COVID, everybody moved to the cloud. Everybody were quick to adopt remote collaboration tools, but security was of concern there, right? As much as we were quick to adopt technology, certain basic hygiene and certain basic principles were left. Certain loopholes which attackers definitely leveraged during that time to, sort of exfiltrate. And what I basically want to talk about is how I want to touch upon a few attacks, especially in the previous years, that actually show how basic controls have to be in place. And one of the attacks that came to my mind when I was thinking about is the forefront dermatology attack, which happened in 2021 actually. So this attack basically happened because of a stale account of a previous employee lying around. So attackers got hold of the compromised credentials, and about 2.4 million PHIs were leaked, right? And they suffered a huge drawback. And if you see the legal class action lawsuit, it basically read this phrase saying that the attack was due to failure to implement proper security protocols. And they said that people were allowed to use incredibly simplistic passwords, right? So if you see, most of the controls that we currently have in place in a lot of enterprises is that basic controls, just the basic controls have not been met, right? So if you want to start from where do we start fixing this? It's the point of entry, which is the authentication part. Now, passwords, some people say it's a thing of the past, but I travel a lot, I meet with a lot of clients, and I know that a lot of industries, a lot of clients still use passwords. So the one thing I would say is if you are using passwords, right, have strong password hygiene, have very, very strong password policies. Now, the thing, what happens when we talk about strong passwords is that they're very difficult to remember, right? So people end up writing them in sticky notes in their notepads. Now it's become all digital. So I just put a small entry of my different passwords on my notepad, right? But what you should be rightfully doing is using a password manager, right? Use a password manager, and preferably what is recommended is that you adopt a single sign-on mechanism so that you use one credential, you remember one credential, and you authenticate very securely, right? Now, how do we do that secure authentication is another thing, which is where MFA comes into place. And like Sandeep said, attackers have been leveraging a lot of factors to combat MFA because MFA has become a gold standard. Almost every regulatory body mandates that you have strong authentication mechanisms. So one of the attacks that I remember that happened with Caesar Healthcare, right? So very recently, what happened was basically attackers, they basically mimicked using AI, they mimicked a person's voice, right? Statistics say that you just need 7 words to actually imitate someone's voice. So they mimicked someone's voice and they called up the IT admin saying, you know what, my account is locked out. Can you please reset it for me? And because this person happened to know the other person at the end, he said, okay, why not? I'll just reset it, right? So, so the minute he sent the link to reset it, it was without MFA being there, and attackers were able to bring down a huge empire of entertainment industry, right? Something very simple, just human contact, relationship, and AI being into the picture. So, as much as technology evolves, it also brings along with itself a set of complications that we have to critically address. So, it's very important to have proper controls in place. Again, when I talk about MFA, one of the important things is that what kind of MFA do we have now, right? Imagine you're a doctor and you're probably looking at some critical records and you have to access, you're authenticating, you've put in your password or you're maybe even going passwordless, and then the next factor of authentication is MFA, and you try to log in. You're going to eventually get tired if you have multiple authentication factors to do, and if you have to do it multiple times a day, because your time is of the essence, especially where you're working, right? So what we basically talk about is having adaptive controls. Now, one of the things that attackers have also been leveraging with respect to MFA is MFA fatigue. Like I said, too much authentication is going to tire you out. And sometimes what happens is, in one of the scenarios, what has happened is to our client, especially when they were looking to authenticate, right? The phone looked like it was glitching. Their mode of authentication was push notification. So it looked like, there were too many push notifications coming. So automatically they just clicked OK. They were tired of just saying no. So they just clicked OK. But that was an attack, right? So that's how attackers basically leverage and gain access. So one of the best things that we talk about is doing risk-based adaptive authentication. So when we say risk-based, every identity in an organization is given a risk profile, right? Based on what time I log in, what devices I use, what is my usual pattern. So this is where AI and ML come into the picture. Very useful. The system basically studies how you function and they give you a risk score. Now, anything out of this ordinary is met with additional factors of authentication or authorization, right? So you're probably, let's say there's some level of risk that is increased with me. And when I try to access a critical device, or when I'm trying to access certain records in my healthcare organization, it's immediately going to either curb the extent to which I can access, block my access, or probably even throw 2 to 3 authentication factors to really prove that this is me, right? So one of the things that we always say right now is that, especially in addition to having a risk-based authentication, the kind of factors that you need to have, right, while you authenticate with MFA should be phishing resistant, right? I know previously we used to use security questions. What is your childhood friend's name, your mother's maiden name, and all of that used to be, the authentication additional questions that we used to pop. But those are things that are easily available now. A lot of social engineering attacks happen to basically know in and out of who we are. So the one thing that is phishing resistant is who we are as a person, right? So you have biometrics, like our academicians were talking about. So have very strong phishing resistant methods in place, like biometrics or hardware security tokens that are phishing resistant, that are compliant with FIDO2 protocols, right? So you have that in place. Now, another thing is, I've authenticated now. I'm into the system, but what level of access do I have is a question, right? So like Sandeep said, everything has to be automated from start to finish to prevent human error intervention. And when I'm onboarded, when I'm brought into my company, I'm given certain birthright privileges, right? So I'm onboarded using certain birthright privileges. Let's say I'm a doctor, I'm given certain access to certain records. Now, anything beyond that that I need access to, it has to be on incremental basis, right? It has to be what we call as just-in-time access. I request access, someone reviews it, see if I really need that access, approve it. I get to access it only for a brief period, right? And then I curb that access again. So this ultimately ensures least privilege principle to be in place, ultimately ensures that there is no lateral movement, less chance for lateral movement for attackers, because people are not sitting with excessive privileges lying around. So that being a very critical factor. And another thing is auditing and reviewing these access on a very periodical basis by doing access certifications. Now I feel like no matter how much technology improves and no matter how much we adopt, we have to be very mindful. We have to be very mindful about these basic hygiene practices, because every attack that has happened in the past, you could probably say 10-20% is very due to very complex technology, or leverages things that have been leveraged to do it. But predominantly most of the attacks that have happened have always been due to basic hygiene that has not been around. So I think one thing is keeping up with the technology, which I think IAM providers, we are mindful of. We will always be there to do that for you. But as a practitioner, or as a healthcare individual, your focus should be to implement basic hygienes, to ensure that these basic hygienes are there in place. And to support that is where I think technology comes into place. Like, for example, a basic hygiene would be to have MFA or additional authentication factors. But to support that is where we have AI driven risk based authentication or dynamic authentication coming into place. So I think that should be the right approach.
Perfect, Jenny. That's one aspect that comes very clearly is yes, technology can be super intelligent and all of that, but when it gets encapsulated to the end user consumption, it's the ease of usage so that the workflow can be done, and
Right.
that it can't be that it disrupts the workflow and thereby they find shortcuts of finding out, like you said, MFA fatigue because you just overdone that, or then you start figuring out ways in which it is one more number added to a standard password and it keeps going across. And unfortunately, with different engineering techniques of, and now likely as you said, social engineering, these can get disrupted. And in healthcare, the vulnerability of that is there because unfortunately, with the setting being so complex,
Right.
the users are perennially thinking in terms of their patients. The users are perennially, so when there's a question asked of them, it's easy to get them off guard, because for them to mentally swap the situation and realize that this is about themselves and not about the caregiving part of it, their vulnerability as an individual starts increasing. So that's something that with advanced IAM solutions, we are able to ensure that the workflows are seamless, and at the same
Yeah.
time, as Singh, Dr. Mevash was mentioning, and as Sandeep was mentioning, the applicability of all of that, bringing that into actual practice, bringing that into some
Yeah.
reality is also key essence. I just want to also, I know we are at the top of the hour two on our time limit, but if I can request Niharika to please put up the link to the paper that Jamia has published. It's a very nice, interesting paper that's written on the subject, and I'm sure all our audience today will have a good reading out of it, and it's a nice paper that's come out of our own academia. That's so it's something that we are indeed proud of. Thank you, Dr. Mevash, for sharing that with us. But Niharika, if you can please publish that Sting link so that everybody can have Sting. Back to you, Niharika, and thank you, Dr. Mevash. Thank you, Sandeep, and thank you, Jenny. Thank you, Dr. Shabana, for the time spent today. And back to you, Niharika. You are on mute, I think, Niharika. we are done.
Thank you so much. Thank you so much, Arvind sir. And as I mentioned, we have published a report on our website. We have earlier also provided the link on LinkedIn also, but here we'll be putting up the link in the comment section through NCOE LinkedIn profile. So you can see that, and also as we mentioned that the different initiatives by DSCI, the certifications and all, as Arvind sir mentioned, you can visit our DSCI website and you can get all the details over there from there. And for regular updates, we keep updating. It's not only healthcare and IoT. We have it's the HI national sector. We cover every section, every domain of cybersecurity, and you can just follow us on LinkedIn and keep visiting our website, and you'll be getting the updates. So thank you so much. Thank you, audiences. Thank you, Arvind sir. Thank you, Professor Mevesh. Thank you, Jenny. Thank you, Sandeep. And Shabana, Professor Shabana had to leave, so special thank you to her also. Thank you, everyone.
Yep. Thank you.
Bye bye.
Thank you.